All right. Interviewing Micah Heiss for Politics of Women's Health with Dr. Day. Micah, tell us how long you've been in EMS for and sort of tell us about your experience as a woman in EMS.
Roughly 10 years. I find that sometimes I'm not taken seriously, especially if there are several males present and I'm the only female.
So, like, if you're in a group setting and, like, you are in a leadership position, like, if you were in a meeting with other men, do you think that you are taken as seriously in that group?
I do not.
And you would attribute that most likely to you being a woman?
Yes.
Okay. Have you ever, like, how far does this expand? Like, have you ever felt like your clinical judgment as a medical provider has ever been, like, questioned because of you being a woman and just sort of like the male domination of this field?
I think initially, yes. And then over time, after proving my competence, that isn't really an issue so much anymore.
Okay. So, like, a lot of women, like, when they get in, like, male-dominated fields, especially, like, first responders, like fire, police, EMS, things like that, they sort of have this feeling like they need to, like, prove themselves in order to be taken seriously. Did that at all cross your mind at any point in this field where you felt like you had to prove yourself?
My entire career.
Really, to this day?
To this day.
And you associate that because of, like, the expectations and the way that people may perceive you or treat you differently.
Yes.
Because of your okay. Do you want to elaborate a little bit more on that? Do you have anything else to say?
No.
Oh, okay. So this is like I said before, this is a male-dominated field. Men, are obviously most of the providers. Do you think that female patients interact with you differently because you're a woman?
I have noticed there have been several occasions where myself and my male partner of a lower licensure will be on scene, and the patient automatically assumes that he is going to be the primary care provider.
Mm-hmm.
But that's men and women patients.
Really?
Yes.
I've experienced that as well. Like, I think me and you have gone into nursing homes
Yes.
or hospitals, and people will hand me the documents and start giving me the report, and it's like, this is not my patients. So yeah, I've definitely seen that. I understand where you're coming from. Do you think that EMS training, like, adequately addresses, like, women's healthcare needs? Like, do you think that the average male provider could really maybe, like, run down all the critical aspects of women's health the same way that might cardiology or
I do not.
trauma? Really?
Really, I feel like there are women's healthcare topics that do not get talked about enough. Childbirth being one, maybe sexual assaults. And I think, well, even cardiac, for
Yeah.
instance, because women don't necessarily present the same as males. And I do think that more education over women's healthcare would be beneficial.
Okay. So on areas, like, I guess some of the more obvious areas would be like childbirth, but cardiac issues. Can you kind of explain, like, what that discrepancy looks like?
So most of the time, men will have your classic chest pain, arm numbness, arm pain. Women can present differently, such as back pain, lower abdominal pain, nausea, vomiting, just generally not feeling well.
Mm-hmm.
And I think that's something that could get overlooked a lot.
And so you're saying that you believe that this gap in sort of information and the lack of focus on this could very well lead women to having critical heart problems and not
being undertreated initially.
Okay. Or even possibly, I mean, if they refuse,
Yeah.
and they don't even get the 12 lead, I mean, they could just not have any treatment at all. I mean, it's very possible.
Yes.
Do you believe that like uniforms and equipment in this field are built with women in mind?
Not at all.
Really?
Not at all.
Okay, let's hear it. Let's hear it.
EMS pants, awful. A lot of services, although there are companies that do make uniforms and equipment specifically for women, there are several EMS agencies that do not order women's clothing. It is all male clothing, and
You're just
you
expected
get
to.
what you get.
Yeah. So that would probably be an example of where, like, you know, women aren't really like catered to or really like, hey, you know, we should probably respect this person in their comfort if they're going to work here. Maybe treated with the same like regard as a male employee.
Correct.
Okay. And what about like equipment? Like, what about the trucks or like any of the like?
Well, I am a very short human. It's fine for me, honestly. I don't really have an issue with that. I think like maybe PPE is an issue as far as face mask and things like that.
Why is that?
Some of the masks I think are built for a male frame. Therefore, you have women who have smaller bone structures and they don't fit properly.
Yeah, I can definitely see that being the case. If you like looking back on your 10 years in EMS, like if you change about one thing about EMS to better suit being like having women feel more invited into the field, what would you change?
I don't know, because you can't really change how you're viewed by other people.
But would you say it's the culture or like so you would say that would you try to invite more like awareness training when it comes to misogyny and prejudice, something like that, or
I feel that could be beneficial.
okay, like just being aware that more aware that having these opinions about women where you don't respect them, and when they're in leadership roles or respect them as your coworkers, there should be more training when it comes to that in EMS.
I agree. Yes.
Okay. So, what's one piece of advice you would give to male providers in your this field when it comes to being a man in a majority male field when it comes to women coworkers and patients?
Do not underestimate them.
Do not underestimate them.
Do not treat them as if they are less than you. Common human decency, really.
Common human decency. Okay, then. Well, Micah Heiss, thank you for your interview.